Morning, Dr. Patino here at the Cosmetic Surgical Center of Cerrito. What are we doing, Gabby?
An extended tummy tuck.
We're doing an extended tummy tuck, and what do you see, Elena?
I see white.
Yeah, that's
no blood.
Yeah, it's a superficial incision. You know, that white part is the dermis of the skin, and we do it on purpose because if I go deep through all this fat with the knife, then there will be significant bleeding. This will not be yellow, it will be red, right?
Right.
And that's what most doctors do, you know. I was teaching this to another doctor and he goes, that's a scratch. That's really not an incision. And he has, 5 liters of blood. And why are you so meticulous about, the bleeding? People can, donate blood and then go right back to lunch, right? I just love this technique. All that is true, and that's why doctors, usually just put the knife all the way down to the fascia, But there is significant bleeding when you do that, maybe 1 or 2 cups of blood, I prefer this way, and after doing it for years and years, I notice that my patients are so good. The next day, they look like they just went to the beach, They don't look operated on. So even 1 or 2 cups of blood, it can be significant on the body as far as lack of energy and how you feel. In addition to that, we all know that, a blood collection, if there is a blood collection in there, it's more likely to get infected. And there is other issues that we probably don't even know, but the blood, when it's not inside the blood vessels, when it is, but even blood loss, when the blood is outside the blood vessels, is irritating to the tissues. So it's not only infection that we know it increases when there is a blood collection, we call it hematoma, but also the blood can irritate the tissues and cause pain. And I think also maybe even seromas, which is a collection of fluid, because we just don't see seromas. I mean, we've seen maybe a handful of seromas in my entire life, and most of the seromas we've seen are from other doctors, usually friends of mine that they ask me to drain a seroma, and it's common, many doctors get seromas on a daily basis. I mean, on almost 100% of their cases, and we just almost never see them. And I think this is why. Thank you. So this line right here that I'm following, this brown line, I don't know if you can see it, that's called the linea alba. It's a hyperpigmented, meaning a brown color line that appears during pregnancy from the deposition of melanin during pregnancy. Oh wow, so this is the abdominal wall fascia, and there's some blood vessels here that we electrocoagulate. Look at that fire, man, it's the fire of God. And that's your belly button that we have healed, and we leave it like a bonsai, right? Like a little mushroom, actually. See, I'm going right around that belly button over here. See, right here where my finger is. That's the belly button. We're healing it like a little mushroom. Incredible. See how it's coming out? Incredible. See? Beautiful. Beautiful. Thank you. Okay, so now what we're gonna do is we're gonna Gary is probably, and that's it. We're gonna probably just come down to here and look at all these stretch marks here. We're gonna remove, and at the end of the day, she's gonna be nice and tight like that. Thank you. Okay, so now what we're doing is we're going over the mark lines with a number 10 blade, meaning that this is a sharp knife, you see, and I'm gonna come all the way down here, and now. See? And what do you see now, huh?
Yellow.
Yellow, beautiful cut here at the Cosmetic Surgical Center of Cerrito. If you want a surgery like this in a bloodless manner, please give us a call. 510-525-7999. Yellow, beautiful cut. Thank you.
So this is the specimen from the left side. It's a small piece, no bleeding. Thank you. And this is the specimen on the right side. Small piece, but no bleeding. Thank you.
Okay. Okay, and what are we doing now, Gabby?
We're making the new home for the belly button.
That's right. Where's the belly button, Gabby?
Right underneath.
Right under there, right?
Yes.
That's incredible. So right there, right, is the belly button. So now what we're gonna do is we're gonna make an incision for the belly button to come out, because the belly button, you know, we isolated it like a little mushroom, right? But all the fat and skin around the belly button we removed. You just saw it, right? Thank you. Okay, so now I'm gonna go ahead and remove this excess skin up on top, right?
Right.
And then we're gonna go and after we do this, we're gonna go and I'm gonna find my finger here and make a hole, right, Gabby?
Right.
See it right there? So I'm gonna go in, and I love this part. Hello? That's my finger right there. Thank you. Okay, so I marked the edge of the rectus abdominal muscle with some purple marker, right, Gabby?
Right.
And what we're doing is we're gonna put this rectus abdominal muscle. This is the six-pack that women have and men have too. Obviously, this is the one that the athletes have. And we're gonna put it together in the midline because these muscles separated to make room for the baby. And there is a hole here in the middle that you cannot see because you don't have, with the camera, you don't have 3D vision, right? Three-dimensional. But what we're doing here is what we call the rectus abdominal wall plication, right? And for those doctors watching out there, this is all probing. Notice the complete absence of bleeding. That's your belly button. And we're gonna put all these together. Thank you. Elena, do you see that bulge over here?
Yes.
That is intra-abdominal fat. Same fat like this, but inside. That's where the intestines are. That's fat that cannot be removed with liposuction or a tummy tuck because it's inside. So what we can do is we can just push it in. She's still gonna have that fat, but we're gonna push it in. And notice, and that's what we're doing when we're doing the rectus plication, but notice how only one stitch. Yeah, only one stitch, right? And below the belly button, right? Because we already saw the ones above the belly button, but only one stitch. Look how much better it is. And then we're gonna continue. And at the end of the day, we're gonna show you how much better she's gonna be. Thank you. Okay, so what we're doing now is we're gonna go ahead and trim the belly button, but I want you to actually, we'll let go of this and let her see. So that's your belly button, but lower yourself down. You can see how flat and nice she is with the rectus plication above and below the belly button. Now what we're gonna do is we're gonna trim the edge of the belly button and pull it out through no skin. But she's nice, flat, and tight right here. Thank you. Okay, wow, look at her. She looks incredible. Beautiful suture line, and she almost has like a high definition look without any liposuction at all. The belly button sinking in beautifully. Thanks for watching.